So, JP, one of the things that that you talk about is this need for recertification after. So once you've gone through this training and you become a CFT credentialed practitioner, that you need recertification 2 years later. Why is that?
Well, there is a potential for clinicians to drift over time. So if we are trained in a particular skill, and you go back to your own environment, you leave that group environment where everyone, or that community, let's call it, where everyone is working and practicing in the same way, and you go back to your usual work or workplace of practice, you can drift back to some of old habits. And so it's quite it's a complex problem, because it's not only dependent on the clinician, and this is not to say the clinician is not willing to continue practicing in that way. There may be barriers related to the place they work, how much peer support they receive. Are they the only person practicing that is aligned with that practice in their work environment? So we believe that to be able to not only facilitate behavioral change with clinicians, but also to promote development and sustainability of that change over time, we need to create communities of practice. And Restore created a community during the training where everyone was thinking alike, and they're supportive, and they're providing feedback that was constructive to support that practice. When you go back to your own working environment, if you have that same support, then you can continue to work in that way. So we believe that to test that and to check the fidelity that clinician that was certified as a practitioner in CFT continues to deliver the care as it was intended to. If that's the case, we need to recertify and do a competence assessment probably every couple of years.